Good morning, everyone. It's a pleasure to be here, and I'm going to take this thing off. I hope nobody gets offended down there. But I have a huge light in front of me, so it's very difficult to look like that. And it's a pleasure for me to be here in Kentucky for several reasons. Number one, because of Chairman Hal Rogers, and why is this important? It is important because I cannot think of anyone else in government that has had a more important role in leading the effort against addressing the overdose crisis and opioid epidemic that our country is currently living. So that's number one. Number two, because actually, maybe many of you do not know, but the first center to investigate addiction scientifically actually grew up at Kentucky, at the University of Kentucky. And it has continued to play an extraordinary role. And number three, because I've learned to thoroughly fall in love with Kentucky. And what I like about Kentucky is not just the beauty of the landscape, but what I like about it is the generosity and caring of its people for one another. And I think that that is an extraordinary strength that you have as a state, and one that is very, very important for addressing the overdose crisis. How bad is the overdose crisis? It is by far the worst addiction crisis that we have ever experienced in our country. And despite the fact that it has been there for 2 years, we have not been able to control it. So in terms of numbers, because we always quantify, and this is data. So the latest data that we have indicates that 111,000 people died in 12 months ending in 2022. And now this number has been growing. And when I first met Chairman Rogers, who was the first one to sound the alarm that we needed to pay attention to it and to put the resources that will enable us to address it, we were in a meeting, and actually he was saying he had a big clock up there. And this actually was several years after he had started to bring us all together to address the crisis. And at the end of his 20 minutes, he said, one person has died. Every 20 minutes have died. And that was around 2013, 14. Now we're seeing one American die between every 3 to 5 minutes. Now think about it, because it is devastating. So we see a number like that, 111,000. What does it mean? It means basically many more deaths by far than many of the preventable deaths. And the issue that is so tragic, apart from the huge number that it represents, is that these individuals, none of these individuals should have died. So yes, we have other conditions like cancers, Alzheimer's disease, but we don't know how to prevent them and avoid the consequences. Here we can. We need to actually figure it out how to work with one another to make it happen. So what are the tools that we currently have? We have very powerful tools to actually address and help those people that are most vulnerable from dying from overdoses. Who are they? They are people that have addiction to opioids, or even if they are not addicted to opioids, that they are frequently consuming them. Why? Why are they at such high risk, and why have we been seeing the increases in mortality with the use of opioids? We have seen it because particularly starting in 2016, we have seen an entry of an extraordinary powerful opioid drug, fentanyl, that has been actually initially slowly, but now rapidly taking over other illicit drugs. The first one to go was heroin, and then followed by other drugs that have very different effects, like cocaine and methamphetamine, that now currently are contaminated with fentanyl. Why? Because fentanyl is a drug that actually is very easy to synthesize. You don't need to cultivate it. And it offers a tremendous profit for the drug dealer. It is also very easy to distribute, and that has enabled to permeate the markets, not just on the Northeast where it started, but throughout the middle and the west part of the country, throughout urban, suburban, and rural areas. And as a result, we have seen that the number of people that get exposed to these drugs have significantly risen. So what are the tools that we currently have? They are based on medications. We have very powerful medications currently that actually, if you provide them to people that have an opioid addiction, can prevent them from overdosing and dying from those overdoses. How effective they are very effective if you give them to them, and they are very effective if the person stays in treatment. And the data to your right indicates the number of overdose averted for a population that we don't think about very much, which are pregnant women that have an opioid addiction, in whom initiating these medications for opioid use disorder, whether it is methadone, buprenorphine or Suboxone, or naltrexone or Vivitrol, any of these medications, if you can keep the person in treatment, you can basically protect them more than 95% as it relates to an overdose, as seen by this data. So if we have these tools and these medications, why are we still seeing such high rate of overdose mortality? And we are seeing them because many people that need these treatments are not given these treatments. And why are they not given these treatments? There are multiple factors. One of them is stigma against the medications. Many providers basically state, and many people in the community believe that you're just substituting one drug for the other, when in fact, these medications have very different properties to those that you see with fentanyl or with heroin. These medications allow the brain to recover, but we are not providing them in part because of stigma and prejudice. The second one is that we don't have sufficient infrastructure or trained personnel to be able to provide these treatments. And number three, the other major challenge that we have is people that are engaged in treatment, that are initiated on medication, if they don't have the support that sustain them in the treatment and restart them once, if they relapse, they actually have very high rates of relapse. And so the challenges are, we are not providing, we are not initiating sufficient number of people that would benefit from these medications, and we are losing many of them to stopping their medications, which again puts them back into a high risk for overdose mortality. So we have the treatments. So if we have the treatments and we know that there are these challenges, us as an agency of science, what do? We actually develop models of care and implementation that can facilitate the dissemination of these medications in a way that is sustainable. So one of the most important investments from the perspective of the National Institutes on Drug Abuse is what we call implementations and services research science. It actually provides the means of understanding in the real world, how do you make this happen? What are the active ingredients that will ensure that an organization will provide these treatments? Not only that it will provide these treatments, they will provide quality care and support that is necessary to keep people in treatment, and importantly, that will provide the reimbursement and the sustainability that are necessary. And this, as you see, involves multiple layers. And as a result of that, for example, I'm highlighting here 3 of the main projects are currently in that we're funding at NIDA, and of which University of Kentucky plays an extraordinary important role. Number 1, healthcare systems. If we can engage healthcare systems that exist across all of the United States, in urban, suburban, and rural areas, and we can train clinicians, whether it is a physician or a nurse or a pharmacist, in the proper screening and treatment, then we have a system that we can use to actually be a first line of defense for detection and treatment. So we basically engage healthcare centers across all of the United States to work together and develop models and treatments that actually can be implemented in healthcare situations. Number two, justice. We know that a significant portion of individuals that have an opioid use disorder, which is the term that we use to refer to opioid addiction, will end up in jail and prison. And if they don't end up in jail or prison, they nonetheless end up in the justice system. So traditionally, the justice, the jail, and the prison, the strategy was, well, you put someone, you lock them down, they will not be accessing drugs, and therefore, they will be treated. Well, that's absolutely incorrect. Addiction is a disease of the brain, it changes it, and it is a disease that actually is chronic, so it basically takes many months or years to recover. And the fact of putting someone in jail with no treatment access, it worsens the situation, such that when the person leaves the jail or prison without treatment, they are much higher risk of overdosing and dying. How much is that risk of dying or overdosing? Is 13-fold higher when someone leaves jail than the general population. So as a result of this, one of our priority research areas has been to collaborate with the Justice Department in order to develop models of care that can provide treatment in jails or prisons and can provide the treatment once the person is released from the jails or prison. And what we found from these interventions, and I was listening to the government earlier today saying, we're seeing a decrease in reincarceration. Well, these treatments significantly reduce not only relapse, mortality, they significantly reduce reincarceration. And they are cost effective. So this is another strategy that we have. And importantly, communities. And this is something that, in a way, we give for granted. The community is out there, but we shouldn't give it for granted. Because one of the challenges that we have is how do we get the communities, the justice settings, the healthcare system, and the state to work together in order to address the overdose crisis and the opioid epidemic. And so that's what we're doing with the Healing Community Study, the most ambitious implementation study that we've ever done at the National Institute on Drug Abuse on 4 states with high rates of overdose mortality. And one of the key states that actually has led in terms of bringing up practices that are going to be useful in protecting people is Kentucky. And in fact, Kentucky has led all the way through in terms of data gathering, in terms of implementation of treatment, in terms of community support organizations to bring people from taking drugs into treatment and into recovery. But at the same time that we're doing implementation research, we also realize, like anything else in science, that we can always, in terms of our treatments, we have medications that work, but we're still seeing significant rates of relapse. We're still seeing actually persons that were responding to them and no longer do that. And this is not different from any other medication that we use for chronic diseases. So we realize that we need to actually continue in the development of alternative treatments. And this is accentuated, this needs to be accentuated by the presence of fentanyl. I told you fentanyl is what's driving that significant rise in mortality since 2016. That more than 50% increase in mortality that happened from overdoses during the COVID pandemic. Fentanyl just dispersed everywhere. It's much more potent, 50 times more potent than heroin. It gets into the brain very, very rapidly. So in order for you to apply the overdose reversal medication, naloxone or Narcan, you have a much shorter window to intervene. And as a result of that, people that are consuming fentanyl are at much higher risk of dying before someone can administer the naloxone Narcan. And it's also, in many ways, harder to initiate treatment on someone that is addicted to fentanyl with medications. So these are all areas where we can actually help develop better interventions, which is what we're doing. As an organization of research and creating partnerships with industry, we're aiming to accelerate the development of alternative medications that are going to lead to better outcomes, that will make it easier for a person to stay in those medications. And we're also thinking into the future, because the way that we deal with things now is not necessarily the way that we can deal with them in the future as we have more knowledge. So for example, a very exciting area of research is the development of vaccines and monoclonal antibodies that actually are going to interfere with a drug getting into the brain that takes them. These same interventions can be used to help reverse in the overdoses. Is it possible? Is it feasible? Indeed it is. And we currently have clinical trials that are evaluating vaccines for heroin, that are evaluating monoclonal antibodies for fentanyl, monoclonal antibodies for methamphetamine. What else is possible? And as I think, and I've been at this job for 20 years, and I've been in the whole field of addiction all my life. I wish I could say since I was born, but no. I started when I went to medical school. I immediately got grabbed by the challenge that addiction poses. And my perspective, and the perspective of the field in general, was addiction is a chronic disease and we can treat it, but we need chronic models of treatment. And I never, ever dare to even allow myself to think that one day we could cure addiction, just like you cure an infection where you give an antibiotic. And as I think into the future, what it is clear to me, in the basis of the fast advancements that we have in knowledge, in technology, in dissemination, and particularly as we gain a much better understanding about how our human brain works. What are the networks and areas of the brain that are affected in people that are addicted? And when in parallel, we're developing technologies that enable us to either inhibit or stimulate and strengthen certain pathways, we have opened up the door for the possibility that we could one day cure addiction. It's not going to happen tomorrow. But if we can see what we've done in other fields of science, there's no reason why we cannot achieve this. Because I want to also emphasize another aspect about our biology, our human brain. We have the capacity to actually recover. If you don't think about it, many of you know people that have suffered a stroke. And now, with proper rehabilitation and strengthening, those people can get back to walking, and if they lost the ability to speak by the stroke, now they can recover. So if we can get a brain to recover from the negative and devastating effects of a stroke, we can get the human brain to recover, not just as a result of our understanding, importantly, how to strengthen those areas that have been negatively affected by the drugs, but importantly, by providing the other aspect of crucial in the treatment of addiction, of support. And I want to end my presentation, because I only have 10 minutes, as I think about all of the challenges and how we have been fighting the overdose crisis. Yes, we've been emphasizing the importance of treatment. We've been emphasizing how our country has been covered with these drugs that now are extremely cheap, available, accessible, and that are exposing so many people, even occasional users, to overdoses. And the question that always emerges in my brain is why? What is it making, why is America vulnerable? What is it that we are vulnerable to these drugs and to addiction? What is the structure? What has happened in our country that is leaving also decimated and people to reach out to take drugs? Because people in the majority don't take drugs just because they want to get high and have a good time, perhaps at the beginning. But addiction is not fed by those individuals. Addiction is fed by individuals in whom taking that drug is a way of temporarily feeling better. It's a way for escaping a reality that is too isolating, too helpless, too hopeless to actually tolerate. So if we think about it as we address the overdose crisis, yes, we need to invest and disseminate treatments and prepare people to do that. But we also need to start to think about prevention. What is it that we can do as a society, as a community, to provide and build resilience in our environment such that individuals, whether they are young or whether they are adult, do not feel compelled to go out and take drugs as a way of an escape in reality. And in this equation, one of the most, and I would say perhaps crucial component, is the interactions that we have with one another, the sense of belonging, the sense of having a mission, the sense of people caring for us, for one another. And this, the sense of a community, true sense of a community, that sense that I know that that person cares for me and will fight for me, is probably the most powerful intervention that we have for prevention of substance use, but it's also the most powerful intervention that we have for someone to achieve recovery. And with that, I want to thank you for giving me the opportunity to be here with you today. Thanks very much.